What a wonderful start to the day. So we have a microphone up front, and we have time for a few questions. So if you have any questions for either Dr. Wisdom or Dr. Nilsen, please come forward.
I was interested in the WIN campaign in particular, and to see if you could help us, if you were able to tease apart why the campaign was successful, and in particular, do you have data on how they access the website and all of the other digital technologies? I mean, when you saw your slides, there were few likes and few hits, so made me wonder, but I wondered if you had that data or any sense of how much was this versus the tech versus the touch.
Great. Thank you, Tony, for that question. I would say that the initial elements of the high touch are really important. We actually brought the website online after these women developed a relationship. So I think engaging them at a high touch level was very important. Mind you, these community health workers they have to have at least a high school diploma. Many of them are from the neighborhoods that they are serving in. The women that they work with see them as my best friend, they're my auntie, they're my confidant. So developing that relationship is key, and that's one of those soft things that from a medical community we want the data, we want all the hard stuff, but those relationships are really key. They share information that they ordinarily wouldn't share with their provider. So I think that relationship building is absolutely key. Secondly, in terms of the data, we do have a fair amount of data analytics or Google Analytics. I didn't share that because I was really giving a high-level view of a lot of what we're doing. But this is all under an IRB protocol too, so we have a very robust amount of data to share. But I would say that we're moving into this space more and more. The initial design of the program was that we would have smartphones in all of the hands of all the women with a data package. It didn't quite work out. We were working with Virgin Mobile, and they were able to give us web-enabled cell phones, but this community, they don't want web-enabled phones. They want smartphones. So that's another area where we are delving more into. We understand that once we get the smartphones and once we have the community health workers more savvy, actually we just sent a team of 4 people to a communications conference, and one of the people that we sent was a community health worker. So she has become sort of our social media person in terms of the community health worker group. So we have to bring them up to speed in terms of the technology, as well as have them teach the women how to engage more with the technology around improving their health outcomes. So we see a lot of promise. I'd say we're at the early stages, but I just kind of wanted to share, our commitment and what we're doing. And there's a lot more to do. And like I said, I'm hoping to hear, even from this audience and from this group of people, how we could take it to another level. Yes, we do have, grant funds we're always looking for and writing for, but also the health system is making a commitment to help us, drive these changes. So we're on the forefront and want to continue to grow that. So I hope that answers your question. If you want to see the Google Analytics, we have a lot of data that describes their patterns on the website when they, how do we get them in and that sort of thing. But mind you, we haven't done a lot of, we don't have a huge marketing budget to drive people to the website either, but we're working on those efforts too. So thanks.
Good morning. Given that the healthcare industry as a whole, or the business of healthcare, is transitioning from more disease management to more patient-centered outcome research to be incorporated, what strategies are you seeing that's being done in the development of these digital technologies, actually getting patients or potential patients actually engaged in making those resources, those technologies, Because at the end of the day, we're going to need a new workforce that's savvy in doing those kinds of things.
Yeah, sure. So I think that's a great point, and I've never seen it done well if you don't bring the community into it. If you don't know what people want, we always think we do. You guys are not normal. I mean, face it. You know, what I think would work, it doesn't matter. I'm not the one it's going to target. And if we didn't learn that from industry, we should, right? You know, thinking about how do you think about, you know, would they think about a market and market segmentation? I spend a lot of time trying to figure out how they do what they do so we can bring it to health. But it's spending lots of time with talking to people, saying, you know, looking at high users, non-users. How do you figure out what's going to work? I do workshops on design with IDEO, the design firm, to try to get this. But it's really having people talk about how they use their device, when they use their device, what kind of things would work for them, how it would work for them. And I think that's when it's really successful. And we've seen, especially PCORI, which is the Patient Centered Outcomes Research Institute. We should just skip the name and go for acronyms forever on that one. But PCORI is funding a lot of mobile now, and it's really bringing the community in. And what's interesting is I think you've got a second point in there, how we teaching them. And you know, what's really interesting is bringing in the young folks who are kind of intuitively good at this, even if they're not trained. And they've become very involved. I work at NSF, and one of the things that we find is they're very interested in this area, even in high school, starting to look at how do you build an app, how do you build a program, how do you think about that, because they get excited by these technologies.
Can I respond to that?
Sure.
It's actually interesting that you did mention PCORI, because we're actually, I'm a researcher for U of M Center for Bioethics and Social Science and Medicine. We actually have a PCORI grant. To your point, though, what we're seeing is that older adults are just as excited and engaged in doing apps and all that, because we do cartoons, video games, all that kind of stuff with seniors, and we're seeing it. I'm just trying, because it's a new area in PCORI. Just what, 3-4 years ago, we were part of their pilot grant funding, and so I'm just trying to figure out exactly what we're trying to do. No, it's a couple. Let's see, Forest Park right here. Every Friday, I go down, and for about an hour and a half, we sit down and we actually make video games and cartoons with seniors. They got time, but they want to figure out, how does this health mean? What does it mean to me? And we use all the domains of health and wellness to make sure that they see the relevance for them, because that's the other piece with all this. Why do I need today? Why do I need this today? I'm okay, I don't hurt. You know, it doesn't. My regular day is my regular day, and making it relevant to them across their lifespan is another thing that needs to be discussed.
Right, that's great. As I mentioned in my remarks at Henry Ford, Dr. Christine Johnson also has a PCOR grant, and my team is helping with one of the cores of that PCOR grant. But I think what's also important is the community-based participatory research methodology and using that CBPR approach. So having the target audience at the table, truly in the room, truly on the team as you're developing these efforts, because we need to hear their voice, we need to hear their perspective. So, you know, there are different ways of engaging them, but oftentimes, sometimes we engage them through a focus group, and then we go back and develop what we think will truly work. However, I think we need to have them involved at a lot of the meetings on an ongoing way. Even with our community health workers, on our evaluation team for our WIN Network Detroit, we had a community health worker at every single meeting. So that she didn't understand the data and what kind of data analytics we were going to do, but she brought invaluable information. And for instance, we were saying, well, how do we incentivize these women to do certain things? And she said, well, a lot of the women are having caseworkers come to their home, and because they want to, you know, child protective services and people coming in to review their home setting and what they're doing and how they're evolving as mothers and caretakers. So they said having them go through a class and giving them a certificate to show their caseworker would be of tremendous value. That's better than a $5 or $10 gift certificate to go buy, you know, something at Target. Give them a certificate to show that they are meeting the requirements in order to protect their children and keep their families. So that kind of information, I would have never come up with that. So we have to have them at the table. So even the women or the target audience, they need to be in those meetings. They need, and we take our teams to, we have them on our abstracts. We had community health workers on our abstracts that we present to national meetings. One of the community health workers spoke at the American Public Health Association meeting, and I see Dr. Wright here in the room too. They presented at APHA, and she was on the panel with me, so I gave my presentation, and then I gave her time, 20 minutes, 30 minutes to tell her story. She had the room in tears. She did a much better job than I did in terms of engaging the audience. But it was phenomenal. So we need to take these people with us and have them truly have a voice at the table, because what they say is invaluable, and it's really going to help us to transform our communities.
Could you please say your name and where you're from when you speak into the microphone? Thank you.
Ruth Parker, Emory University. So great talks, thank you so much. Wonderful introduction, and I love the juxtaposition and putting these two topics together with the great energy of what we can do and all the opportunities in making health fun, and also simultaneously thinking about the communities, especially high-risk communities, and engaging them. So my question is, I don't have the data at my fingertips, but I have heard warnings or potential unintended consequences about the carbon footprint of all the technology that we're engaging in, especially as health systems, as individuals. And I'm wondering if you're aware of any health system that's tracking, monitoring, engaging the communities, how that might impact certain communities more than others, and whether or not there are funded research efforts right now that are a part of the NIH funding for some of these that are simultaneously tracking some of that, and how we figure out what really works, what doesn't, what are the potential adverse consequences, what is the carbon imprint, where is it? As we try to figure out how we make it good and fun, we also do a lot of things that don't end up working. So I was just curious to know if you're aware of anybody sort of on that.
Want me to start? You can start. Okay, that was tough. So we're flipping a coin here. You know, I think you're talking about a bigger question. I mean, technologies have changed the way we live, for good and for bad. I mean, we're a completely different kind of world than we were even 10 years ago. And I don't think we have a clue what we're going to look like 10 years from now. So I think these are bigger issues. NIH has not started really looking at this because it's part of a larger effort. I would assume there's interest in this in the energy sector, especially probably at NSF in this. But you know, it's these changes have happened rapidly. They're happening by the hour. You know, the changes in the way we do data and the amount of data. If you actually look at how much data is being consumed and how much data is out there, I forget what it is. Like we make more data in a year now than we used to for 10, you know, I mean, it's huge. Yep. So I think these are a bigger issue. We haven't gotten it to the point of thinking in health specific, because really at this point, we are a piddling in that thing, so.
I think it's a great question and a good, something to be mindful of. I am not aware in any of my reading or dealing with healthcare across the country, anybody that's really paying attention to that. I mean, I think we're paying attention to brownfields and childhood lead poisoning prevention and so many other environmental, you know, the air quality and contributing to asthma. I mean, we're doing a lot of heavy lifting around that, but the carbon footprint, that's something I don't think we've paid attention to. But again, like you said, that's one of those unintended consequences that we need to begin to have those conversations and see how we're going to concurrently address that too. Some of the statistics, I didn't read all of them here that in my opening remarks, but I think the one that talked about people having by 2020 equivalent of 26 devices for every person. I mean, and I see that as a reality. I mean, I've got 2 iPads, 2 iPhones, iPod, 3 computers. I mean, it's just like, and I'm still behind on my email. So, you know, but I can see that really occurring. If I added it up, you know, among the people in my household, it really is growing. So I think that's a really great question, and I'm going to share that with my environmental health people in terms of beginning to think about that.
We have time for one more question.
Misha Pavel, Northeastern University. By the way, the carbon footprint, I've seen some analysis that mobile technology will help it because you avoid traveling to appointments. My question is to Dr. Nilsen about her inspiring talk, which I really appreciated. But what do you see as the greatest challenges that we need to overcome in the next few years in order to really achieve the vision that you so beautifully portrayed?
Oh, I love getting set up like that. You know, the World Bank just came out with a thing and basically said in information communication technologies, which mobile is one, the complete missing link is user-centered design. Creating technologies and programs and information that people can actually use and want to use. We're not there. I mean, there are sciences in this, but let me tell you, they're just touching this. We need to partner with industry. We need to partner with communities. We need to really, I mean, we need to start thinking of health as competing with other things. I mean, think about what you have to do in your day. You know, did I not do my exercises last night because I thought, oh, exercises, I don't feel like doing those now. They're boring and I didn't want to do them. No, I thought I have to finish my talk. I had to talk to my husband. I now had to figure out how to get the homeless man money for his phone. My son texted me about something. I mean, I had to deal with all that. Health was totally competing with that. And we need to think about, you know, everybody else, I mean, there's so many places that have been very successful in competing for precious time, right? Think about YouTube. It's now the number one search engine, I think, for young people. So think about that now you know, how do we use what people know, and we don't have the money that they do, but we can still think of that, and there are really, 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 really smart people who are a little freaked out about, you know, health and disparities and stuff, who will come over to the light side and work with us. You know, I mean, we've been seeing it happen lately. So that to me, it's the missing link, and we need to walk up to it. We need to make a science around it. You know, we don't just need to make it nice. Yes, somebody's nodding. I'm NIH. Yes, we really want a science around that. But we need basic principles. We need what works for who and when. We also need to know, like, how do you use your technologies? Like, you know, one of the things I thought was really interesting, I was talking to the diabetes program recently, and they see 3 patterns. One, they start and they stop, and you have to get them to re-engage. One, they start and they stay forever. And one that they start, do really well, stop, and then come back. And traditionally, we freak. The two that stop, we freak and we try to do something. But if somebody learned the skill and they went away, we should actually be pretty thrilled that then they come back to touch back. And we should be thinking, you know, I hate to say this, like Angry Birds. We should be coming up with new models as we go. There's an Angry Bird Rio, and I'm sure there's a Frozen now. And we have to keep kind of modifying and exciting ourselves and keeping people engaged. But we need a science around this. We need basic principles. We need people to really be able to say, when you're starting to build something, you can say, oh yes, best practice in this area is this. And it won't be one, and it'll be complicated, but it'll make it magical.
That was great. I think what's going to be really important is to integrate health and technology into our lives on a daily basis. And let me give you an example. I've got to say this kind of carefully, but all of you are sitting out there, and now sitting is considered the new smoking. So I'm trying to quit myself. But sitting is a new smoking. So I envision a future where at meetings like this, people will be standing and walking, even 2 miles an hour, on some kind of device. So you don't have to worry about trying to fit it in. If you've gone to your meetings for the day, you will have gotten your 10,000, 20,000 steps in because you've been at meetings all day. So I think we need to find newer and great ways to integrate that. And, you know, even in meetings at Henry Ford, we say, stand in the back of the room, stand up. We have walking meetings where you walk around the building and you talk. So integrating it in so you don't have to worry about, did I fit it in? That things become much more automatic and automated. I think also it's going to be important to empower our empower people that aren't traditional healthcare professionals. And we try to do that a lot with our young people in the schools. We give them a lot of information, and they know what's better, an apple or a bag of chips. I mean, they have a level of knowledge that is fine to help them influence their colleagues. So we're empowering them. And through the Generation with Promise, I showed a few slides, but we're in 13 schools with youth leadership development. It's around being healthy and embracing healthy lifestyles. But we're empowering them so they feel like they can help guide making health decisions and use health technology. So they become our ambassadors. In many ways, they're kind of our secret weapon out there, because their colleagues, their other students in their class will listen a lot better to them, and particularly when they're in the lunch line, that sort of thing, than they will somebody coming in a white coat and saying, you ought to do this and you ought to do that. So we need to empower people in ways to have them deliver the messages. So I think there's a lot of fun things on the horizon. I think in 5 years, our world is going to look a lot different with ACA and what's happening. I think we're going to have much more truly, patient or community-centered and community-driven, and then we as healthcare professionals will be there to support and have the science and make sure they're doing the right thing, but they need to drive a lot of these efforts. So I think it's going to become very exciting.
Yeah. Fun. We should work together.
Thank you very much, Doctors Wisdom and Nilsen. That sounds like a Hollywood combination. So
here we go.
So we're going to take a 15-minute break until 10:15, and at 10:15 we are going to start on panel 1. Okay.
Well, that was fun. Thank you.